Hello, good afternoon, everyone. Welcome to the chat show where we talk about the empathy, innovation, and employment, where employment is the focus area. And there are two forces empathy and innovation is driving employment for really for everyone. In this show, we talk to the thought leaders from the staffing industry, from special needs education, from the disability community, as well as from the autism community. And today, my guest is Abigail Erickson. She's the CEO of Bryan's House, an impact agency developing progressive and accessible pathways to inclusion to better serve more at risk children with special needs in about 8 counties in North Texas. For 30 years, Bryan's House has served children with medical or developmental needs and their families by providing specialized childcare, respite care, and social services. Um, with that, Abigail, thank you for doing some amazing work and impacting thousands of families in the North Texas area. And welcome to this conversation.
Hi, Nish. Thank you. I am so thrilled to be a part of this program. Already, I'm just loving the fact that you have someone who's doing sign language, which is fantastic because my daughter has hearing loss and special needs. And I can't wait to chat with you more. You're a great guy, and this is a great forum. So thank you for including me.
Thank you. So, uh, Abigail, see if you can share a little bit about your journey because in our conversation I have learned just amazing work you do, work with parents and special needs children. Your journey, how you are really creating more inclusive future for children with disabilities and autism.
Thanks, Nish. So Brian's House has been around for 30 years, 33 years, and we really were started to work with children that were impacted by HIV and AIDS, born with AIDS, and their parents were being mothers were born with AIDS and passing. And so over time, we've been able to transition our services into a very unique model in the fact everything we do has case management attached to it. So we're really holistically serving children that are very at risk, meaning that their family members make less combined than $23,000 a year. But their children, and typically we have normally family 3 or 4 where 2 or more children have a special need, whether it be a physical need, a social need, emotional need, or a therapy need. So we deliver all of that through different services throughout the North Texas community. And over the last 3 years, it's really been evident to me that many of those children, if they had only just had early intervention, a lot of the challenges they face personally, but also with their families, could have been, I guess, their pathways to inclusion would have been more accessible. And so we really started working on this thing about early intervention leading to employment. So, what is that pathway from when a child in our care, from infancy right up until 21, which is the age we serve, up to 21? We also do the transition planning. So, what does that look like? What does that look like to an employer who knows that the child started early, and then there's ways for them to be hired in the future? It's really quite a simple, it doesn't sound simple, but it really is. The earlier you intervene with the child, the more opportunity that child will have to overcome some of those challenges. And so that's really what we've been working on over the last 5 years as we sustain our programs, improve that quality of care, but also ask the question, what are employers looking for, and what are those programs, and who's doing best practice? And to that end, we've come up with some great ideas.
Yeah, no, that's amazing. So I also, as you know, I'm a big believer of this early diagnosis to early intervention, and as we all know, we have seen there are some evidences where early diagnosis to early intervention can really change the diagnosis and make a huge impact on person's life. So with that, tell us a little bit about your early intervention program and how from that early intervention to the adulthood and some of those vocational skills and how you see that transitioning into a meaningful job, because what I have learned from you that that's a whole
Sure.
school life. Yeah, please go ahead.
Well, so Brian's house, we have an on-site child development center here. So some of the children that we serve out in eight counties here, they actually come to our campus for care. So if you look at a classroom, a typically developing child is not receiving medical care in the classroom, but our children do from the age of 0 to 5 here on site. And so we work with our case managers and our health workers, our teachers, and all of those folks to come up with a care plan. So we make sure that the child is getting the therapy they may need. We make sure that children are receiving dietary feeding tubes and breathing tubes and getting their hearts monitored. And some of our children have seizure disorders. In fact, about 147 diagnoses under this roof right now for summer camp as well. So we have a lot of children in our classrooms that have autism. And so you can imagine the combination of those kiddos in one class. We have to really make sure that them and that the teachers know these children well, and that we are providing the right access to therapies, and that we're also empathetic to the families and their plight. The children stay with us for longer, and we help to transition them out after age 5 into other school districts. We work in partnership with some universities. We work with the University UT Dallas. We work with 3 nursing schools, and we are a model for their practice. Students come on site and also see what best is. And we start talking to employers and other nonprofits that may take that role of, say, age 12 through 21. What does their education plan look like if the child can actually attend a class with their diagnoses? And so one of the things we decided to do was to really, and this is before COVID-19, we decided to do a luncheon called Pathways to Inclusion. And the luncheon has been postponed, but it's coming up. We have a panel of experts from around the world, including Hiran Shukla, one from Microsoft, Richard Margolin from RoboKind, who's invented IT and AI technologies to help transition children with autism in the class, as well as some other leaders from Fortune 50 companies based here in Dallas. And we're having this great luncheon to talk about what it looks like for someone to come in that has a challenge, is in a wheelchair, or they can still function and earn a living. What do those roles look like? Who are they? And so a couple of examples. Bank of America is doing a great job. Ernst & Young has their neuroscience division where they're hiring those that are on the spectrum, and they are really working on the data and working on with computers. It's fitting. So there is a pathway. We just have to make sure that when we're talking in community healthcare providers, that there is access to understand how simple the pathway could be if all of us feed into that one path. It's going to really save a lot of money in the community, especially if the children get that early intervention. And that it's really changing their personal souls and their ability to be mobile and independent and get the care they need, especially if they're living impoverished or are running from transitional housing or homeless. The parents, the mother's been abused, all those things.
Yeah, no, that this clearly demonstrates all the great work by Brian's house under your leadership, how you really created a pathways from early intervention to the ultimately have a meaningful job. So you mentioned briefly about the luncheon and some of your recent initiatives on putting together some program and some event. Tell us a little bit about that event. What is that, and who what is the goal, and how Brian's house is connecting parents and the whole community to ultimately employment.
Well, I think one of the things is that because diversity and inclusion is really come to the forefront over the last 24 months, that there's more acceptance of, looking at how do companies employ people with autism, or how can we quote unquote normalize what it looks like to hire someone the employment, not only the company but the people that are employing, that they feel good about hiring someone that has a disability. And there are many people that also, their challenges are hidden. Many people, like my daughter, you wouldn't know that she has hearing aids, or somebody having a physical challenge, they may be wearing hearing aids, or somebody has outside, or someone has a physical challenge, they may be wearing, like a leg brace or whatever that looks like, as long as we're having those discussions. So the luncheon is based around bringing people together in one community and saying, this is important, this matters. How can we build a pathway to inclusion using the strength of all the services available and our partnerships? We have to start having those conversations. We can't just use diversity inclusion in a marketing piece or a tool. We really have to start living that authentic path by including people in everything we do. That comes from LGBTQIA, you name it. We have to really start looking at everything and how can we better our community by having that pathway and talking about it and trying not to. In this panel, they'll be asked a series of questions. John, who's with Mensa, he works in the LGBT community, and he'll be talking about inclusion. And Tracy's talking about the technologies they have in the classroom and how that's helping students to learn. There's just so many. Laura Ramirez from Invitation Homes, she handles the diversity inclusion for that the nation's their company, and what that looks like. Language is important, and all those different things. And so it really, as well as highlighting our Wisdom Hope awardees, who are community leaders and companies that are doing a really good job with inclusion and working with our families. It's just going to be a great way for us to all in person to come to the Bilo Mansion downtown. About 400 people, have a great lunch, and just hear some really interesting things like best practice from people like Kieran Shukla, just on 60 Minutes, talking about this. They are really leading the way in neurodiversity, and those folks with autism across the world, really. They just opened up a new division in England, I believe, and there's some really exciting stuff going on. So let's all come to lunch and enjoy each other's company. Obviously, we'll be social distancing, and if you've been vaccinated, that's good. And if you haven't, you wear a mask, and we take every precaution. But I'm excited to see everybody and have these discussions. It's on September 2nd, so there's time to buy a table or a ticket if you want to be a part of it.
Great, great. I'm having a little bit difficulties in understanding, but I'm doing my best to figure out. I don't know if it is a technical challenge on my side, but yes, I agree with you. That's a great event. That's a great opportunity. From Rangam side, we would love to participate and contribute to all your work. If we step back a little bit and talk about a little bit more on how you are providing the support during the pandemic. We all know some of the things which has really challenged all of us. working with children as well as adults on the spectrum and people with other special needs or different needs. Tell us how was your the whole experience during the pandemic and some of those challenges.
Sure. As you know, if you have autism spectrum, it really depends on, what are the tools that you're accessing and how your children are being properly assessed. So one of the things we want to do is the early diagnosis piece, and we're really developing that. Hopefully, there's a waiting list of about 5 years in some cases where autism is not even recognized, and so we really want to develop that program. And I think for me, the best things that I've seen are those children that are interacting in class, either virtually. We now have all the children back on side, which is great. But the ability to teach each other about inclusion, because we teach inclusion here at the centre. I think it starts off at home and in your schools about including children that have learning differences, and everybody's individual, and we were able to really work with those families, and it's meant so much to the families. I get a little bit emotional that would come and run out because they weren't diagnosed with autism, and we'd be like, oh, I think that person needs a diagnosis. And the challenge is that, if you're at risk, you're not going to be able to afford a doctor to say this child has autism. They only get the emergency care or whatever that is. And so we're making a real difference. I think that's how we're trying to find another link in the chain on I guess a pathway, another stone in the path there, where the child is early diagnosed and that they have that access. Because access without empathy or empathy without access is not, it's not the right way to go. You have to have both. So even if your community is trying to do the best they can for
That's right.
children with special needs, if they don't have access to a diagnosis, they can't get the therapy they need or the care they need. So we're able to provide that. And so during COVID, we moved all of our classrooms and our case management online. We were able to give families basic needs. We intervened early with emergency funding assistance for their rental or utilities. We were able to keep our kiddos safe during COVID, and they didn't lose a step on any of the education initiatives. So they were still progressing, still getting their therapies they needed, and so on. So it has been the most extraordinary year, but I think our best yet, because my teams are amazing. They're raising more awareness about, the spectrum not being a bad thing. If your child has challenges, we should embrace that. And then there is, for many families, and I know some of you who are listening today may have a child with autism or have Asperger's or whatever that looks like. But there are really new opportunities, hopefully opening up. And I know through your programs, Nish, and your amazing technology, and things you've talked to me about, that there really is a future that's very bright. These children, they can become independent and maintain their independence, relieve the burden on government for funding, and also contribute to a better community where diversity rules.
That I and that's where we got really connected well in our vision and mission that government funding is great to start with, but it's not sustainable. How do we build a models where we can really have this kind of initiatives, programs, employment programs, which is kind of more we call this with the support system, natural support system built in as part of the some of the employment related models. But thank you for sharing some amazing information related to how your team has really done an amazing job during a very difficult time. Would you do you have some thoughts on, or please share your thoughts on how this some of these changes which we have, which you and your organization and your team has adopted during the COVID, during the pandemic, how is that going to help you do better in post pandemic phase?
Well, I think, sorry, the slight delay. I think for us, really, we were forced to um, go online a lot more with our clients. We get referrals from about 10 different hospital networks. They refer children to us, and also because we've been around a while, we get a lot of referrals on the phone. And so we changed the technology that changed for us. We brought everything online. So all of our forms, if someone was new and wanting care, how we deliver emergency supplies, and how we were able to maintain our agency, clients were getting the care they need, but also look at the needs of those families through COVID and how we could join them up with, through Texas Workforce Commission or other different agencies that were a specialist in either homelessness prevention or employment, making sure they had access to find work. And so during that time, we started really streamlining how we were able to process the data that we were getting coming in, and how quickly we could turn around our teams. And we're able to meet with some folks who didn't even have a phone. So getting them access to a burner phone they could get, trying to find work. And I'll give you one example. One mother who's very resilient, her husband got sick, couldn't pay the bills, they lost the house, and out about it. And one of their children has severe hearing loss. The other one, sorry, the one of their children has in a wheelchair, also has autism and ADHD. So mom was working for a company like Uber, delivering meals at night so she could stay at home with her husband and the children. But when there was a glut of those people now joining Uber to deliver meals, she lost a lot of her money, and so they found themselves without a home. And it's very hard to admit that to someone. And so when we helped her, she was able to, within a very short period of time, we were able to help her find a transitional house because they were in a motel for almost 6 months, actually 7, with 2 rooms and 3 children and one in a wheelchair. You can imagine, and dad's sick and can't work. She was carrying the load. And so we were able to wrap around her family. Now I'm happy to say they're in a house they're all renting. They received some additional funds from a private donor who was able to get the medical equipment that she needed. And she's now working full time and got her husband on insurance. And he's able now to get better so he can go back to work as well. And the children are getting therapies in the home, and she is just a rock star. We also created this program called Beyond Breaking Barriers, which is an extension. It goes case management for someone with autism or special needs. So mom was working for a company like Uber, delivering meals at night so she could stay at home with her husband and the children. But when there was a glut of those women one-on-one, looking at themselves inward, like if they're getting enough personal time to heal or their mental health is okay. So we really, those are the things we've been doing over the last 18 months. And it's been an extraordinary experience. It's really, my heart is so full.
That's a true reflection of complete innovation, right? And that's where, we were all forced to think differently and come up with solutions. And these are all the perfect examples of how Brian's house is really, and your team and you and your team are really innovating and building solutions overnight. And I'm pretty sure all these great ideas and great approaches are going to help your organization and the whole community to do better and more impactful in coming years. Um, um, so with that, see if you can share some of your. You already have shared some, but some empathetic approach you and your team has taken during this time, because as you know, our theme is empathy to employment, and I'm pretty sure you have some examples how your team did amazing work and in an empathetic way. Um,
Well, I was lucky enough to finish a course in emotional intelligence during the course and of the COVID. I did that at home, and I really tried to apply those best practices to see what our team was needing and how I could support them as a person who leads from the bottom up. I try pushing. I support. What do you need from me instead of what do you need from me? And so really arming arming the teams to the teeth with what they needed, emotional support. It's very hard, and I say this to the family members too. Another way we could be innovative is really do that. It's not just the case management, because case management isn't counselling. We want to bring in those folks that can counsel, because you can schedule appointments for yourself to get well and for your children. But if you are so depressed and you can't get out of bed because of that depression, it helps no one. So having access to telemedicine, and we really want to build out our clinic to be more of a diagnostic mental health, as well as counselling some of our members. That's something that we're growing towards. And I think this one particular family who were just incredible and really did amazing work through during COVID was working. Once they had been helped, they came back to help us volunteer. We did emergency drive-throughs, and we had 200-300 cars lined up. We were providing diapers and wipes and food, and we had the nurse going through, a clinical director going through, asking the families, "How are you?" It's okay to say if you're not okay. And so we really just had those very, again, authentic discussions. And one of the ways that we bring empathy is through our development of our core values. And we have an extraordinary group of board members. We expanded, in fact, from 15 to 21 board members. And our board member group is really diverse. And when you say, I've got a diverse board, what does that mean? And how empathetic are you to the plight of the people that you're serving? Because your board better look like who you're serving. Because if it doesn't, you're doing your agency a disservice. So we have 21 incredible board members who some have a child with special needs or know a family member with special needs. They come from different companies like Target and Michael's companies, Gesture and Genius, who are amazing branding agency here in America, who works with global companies. Gensler, we have wealth management companies, UBS. All these folks who are on our board represent these major companies. They bring their expertise, how we can bring more empathy into what we're doing. I think it's important to see what other groups are doing and really see if we're doing the right thing and how can we improve. So those are the things we're trying to do and how we try to bring empathy into all we do, and especially those core values. You need to add that to your core values.
I 100% agree with you. All the things what you mentioned, and I I apologize. We are having some difficulties, technical difficulties on the connection and the delay. Um, but what I have understood that, and what your all your work at Brian's house is a true reflection of empathetic leadership, where you are not just making an impact yourself as an organization, but you are really truly connecting the community and bringing those thought leaders like all your board members and bringing them to the table and say, what can we do in an innovative way, empathetic way, and how do we spread, how do we spend or expand our impact in the community where we all live in. So thank you for doing some amazing work. Before we conclude, any last minute thought, concluding thought, and a message for the audience for today?
If anybody would like to learn more about us, we're at Bryan, Bryan house.org. If you want to join in the conversation, just message me on LinkedIn, DM me. Love to chat and spread the word. If you want me to come and chat with any companies, be happy to do that. As long as you have that thought and keep up, I'm excited. So I want to thank you for the opportunity, Nish. You're a cool man, and what you're doing with your company is phenomenal. I'm so impressed.
Thank you. Thank
Thank you so
you,
much.
Abigail. Thank you so much again. Thank you for your all the great work you do. Would love to continue this conversation. And thank you everyone for joining us today. We will continue our conversation on empathy, innovation, and employment for everyone next week, same time, same place. Till then, stay safe, stay healthy. Thank you so much again for your time and your thought leadership, um, Abigail. Thanks,
Thanks,
Thank you.
everybody.
Bye
Have a
bye.
great rest of your day.